Hi, my name is Amberlea Villafane, and I'm a BCBA here with the Carolina Center for ABA. I'm here with Melissa Monti, another BCBA, and Cassidy Leovic, an RBT, and we are here today to discuss an intervention created for our client. This intervention was a data collection system for influential variables that we then use to modify the data collection for skill acquisition. Most of us can likely agree that our clients come to us with a variety of medical variables that impact their session. As we work with our clients one-on-one each day, we develop an intuition into their behavior. We start to notice subtle changes in their demeanor or interactions with us and modify our behavior to accommodate them. Something that commonly occurs is pairing in a session where their client is reported to be tired. But although this approach may benefit the client at times, it does not align with our principles of ABA. We would like to propose a technology to quantify influential variables and use this data for an objective and systematic alteration to treatment. Our participant displays great variability in skill acquisition related to the presence of numerous variables. We work to operationally define 6 different influential variables ranging from the magnitude of self-simulatory behavior to the presence of medical factors. Each variable is scored independently through its own rating scale, and then a derived score is achieved. Low, moderate, and high rates of variables are categorized accordingly as green, yellow, or red days. Each corresponds with its own data collection for a skill acquisition goal. We are currently in the beginning of our intervention teaching receptive identification of emotions through this stoplight procedure. Green stoplight data will be compared to a control of skill acquisition conducted using traditional means of data collection that does not consider influential variables. Using these concurrent data collection systems, variability in correct responding due to the presence of influential variables will be identified. This will allow us to quantify the impact that influential variables have on the data collection of skill acquisition goals. It is our long-term goal to then use this data to reduce variability and increase the success of all interventions. Now, Cassidy will move on to explain our participant and procedures.
Our participant is a 5-year-old boy diagnosed with OCD and level 3 autism. The data collection occurred during the client's ABA home sessions with his RBT, and the dependent variable of this study is going to be the client's ability to receptively identify the 4 emotions: happy, tired, angry, and sad. The independent variable of this study is the data that is collected and counted towards the client reaching mastery criteria on these goals. The technology we created is referred to as a stoplight procedure, and it collects data on the variables that can affect the participant's ability to correctly respond to skill acquisition goals, which hinders the participant's ability to meet mastery criteria on many of his goals. The procedure consists of 2 periods of data collection on the influential variables the client might be experiencing throughout his session. The first data collection period occurs 15 minutes after the participant's ABA session begins, and the second data collection period occurs an hour after the first data collection period ends. Before each data collection period, there is a 15-minute pairing window between the client and RBT, or between the client and RBT. We included this 15-minute pairing before each data collection period to decrease any carryover from the previous data collection period's influential variables. The variables that we collected data on are stimming, attending, challenging behavior occurring 30 minutes before pairing, challenging behaviors that occurred during the data collection period, sleep, eating, and any medical factors the client could be experiencing. We operationally defined each of the variables relevant to the participant and designed a rating scale ranging from 0 to 2 to determine the magnitude of the influence for each variable. Stimming was scored based on the client's ability to be redirected to another activity. A 0 was scored if the stimming was not present during the evaluation period or if its ability to be redirected was possible. A 1 was scored if the stimming was present and it required repeated attempts at redirection between 2 to 5 prompts. A score of a 2 was stimming is present and attempts at redirection and blocking resulted in aggression or self-injurious behavior. The participants' attending and challenging behaviors were scored using partial interval data collection, and we collected data on the amount of intervals that the behavior were present for. There are 5 intervals, and each one lasted 2 minutes long, which totaled that data collection period to be 10 minutes. Attending was rated as a 0 for the client engages in 3 to 5 partial intervals of attending behavior during the evaluation. A 1 was scored if the client engaged in 1 to 2 partial intervals of attending behavior during evaluation. A 2 was scored if the client engaged in no partial intervals of attending during that evaluation period. The challenging behavior was rated as a 0 if the client engages in challenging behavior across 0 intervals of evaluation. It was scored as a 1 if the client engaged in challenging behavior across 1 to 2 intervals during that evaluation period. And a 2 was scored if the client engaged in challenging behaviors across 3 to 5 intervals during the evaluation period. Information on sleep, medical factors, and the client's challenging behaviors prior to session were obtained through an informal interview with the client's mother at the start of session. Medical factors and challenging behavior were scored based on the frequency of the variables occurring. So for example, if the client experienced between 2 or 3 symptoms, that score would be a 1. If the client's sleep was scored based on the combination of frequency of times the participant woke up and the duration of sleep the participant missed due to waking instances. For example, if the client lost more than 3 hours of sleep due to his waking instances, that would be scored as a 2. The client's eating behavior was measured on the amount of food that the RBT observed the client eat for his most previous meal. His session started at the same time his meal time did. A 0 was recorded if the client ate half or more of his previous meal. A 1 was recorded if the client ate less than half of his previous meal, and a 2 was recorded if the client did not eat any of his previous meal. At the end of the variable rating period, the RBT totaled the variable scores and identified the color of the data collection period as the following. A green period, which was when the scores were totaling between a 0 to 2, a yellow period for scores that totaled between a 3 and a 4, and a red period for scores that totaled as 5 or more. Once we knew the color the period was, we then began skill acquisition data collection. We used errorless teaching and prompt fading to teach the client to receptively identify the emotions happy, sad, angry, and tired, and these emotions were separated into 2 groups. Angry and sad were the traditional and also known as a control group, which means that the RBT ran the receptive identification goals normally each day and collected the data for the client's response as normal. For example, the RBT would place the SD for the client to touch angry and provide the relevant prompting and then collect data on the client's response in touch angry target. The second group, named the Stoplight data group, was comprised of happy and tired emotion cards. Each stoplight emotion had 3 data collection targets associated to the goal for each of the different colored periods. Then the RBT would run the receptive identification goals and record the client's response in the target relevant to the data collection period. Let's say the client scored a yellow for the most recent data collection period and the RBT placed the SD to touch happy and provided the necessary prompting. The RBT would then record the client's response in the touch happy yellow target. Each data collection group was run during separate halves of the session, and we alternated the daily sequence. The RBT would run each goal 5 times during the data collection period. For example, if the control group was run for the first half of session on a Monday, then the stoplight group was then run on the second half of that Monday session. Tuesday would begin with the stoplight data group being run first, and so on and so forth. Now, Melissa is going to go ahead and talk about the results in the discussion section.
The results of our data collection are shown in the graphs in the top right-hand corner of the poster. Please note that data collection was limited due to COVID restraints and other factors. The top 2 graphs show data from the stoplight group, emotions happy and tired. The color of the lines on the graph corresponds to the color of the data collection period. The bottom graph shows data from the control group, emotions sad and angry. The colors of the lines denote the different emotion targets. Our goal in collecting this data was to see a trend that indicated the client was more likely to have a higher % correct on green data collection periods and a lower % on red data collection periods. We see the client score for happy leveling out at 100% correct on green data collection periods, indicating that he was more likely to respond correctly during that time. However, data on other target emotions shows variable scores, making identifying a pattern difficult. Please note that there were some limitations to our data collection. The client's skill acquisition could have been due to features of the stimuli instead of influential variables. For example, the client would frequently respond to the question by pointing to both cards rather than pointing to the card that the RBT was pointing to. The second limitation was that the targets were being presented at 2 different times of day. And the last limitation was that we only used receptive identification to probe the skill acquisition rather than including expressive identification. In conclusion, this is our first step towards quantifying the influential variables our participant experiences surrounding sessions, which impacts his ability to engage in skill acquisition. We believe that this intervention can be of great help to many other individuals that experience drastic differences in their programs from the presence of influential variables. Individuals with ASD are at a higher risk of comorbid conditions that impact the success of ABA. Future studies should control for the presence of stimuli with extraneous cues. Targets should be presented during the same time period each day, and several different types of skill acquisition targets should be presented for study. In the future, we hope to be able to bridge the gap between the client's ability for skill acquisition between the days where he has few influential variables and the days he has many influential variables. Before we end, we would like to acknowledge Kelsey Murphy for sharing a procedure she used with a client that inspired us to develop this intervention.